And we are live here on YouTube. Let's dive in. We have a fabulous Friday here, a little live Q&A action. What is on your mind, y'all? What is up? Off the bat, a study kind of rolled by my desk this week. It was, I think, an increased chance of all-cause mortality, 50% increased chance of dying with soft drink consumption, and that include sugar-free soft drinks as well. Now, number one, why are sugar-free soft drinks not the best option for you? So number one, a lot of the additives in there. So Splenda is a big one, which is a glucose molecule with 3 chloride molecules attached. There's some data on these compounds negatively impacting gut bacteria. So one potential school of thought is negatively impacting gut bacteria could be part of the underlying root issue, what's happening there. You have things like aspartame as well, which is going to be an aspartate amino acid bound to methyl alcohol, which is a little bit more of a toxin. That's a stressor, potential neurotoxin / excitotoxin. So we know some of these artificial sweeteners, even though they don't have extra sugar in there, they can definitely be stressful on the body. And this one European study showed this increased risk factor of dying 50% with some of these foods. So you really want to keep these foods or these junk processed drinks out of your diet. It's going to be a really, really big help. All right, cool. Are you guys seeing me okay on the stream? Is the quality all right? Let me know. I'm getting a couple of errors here on my side. Let me know what's coming in on your end. That's helpful. Okay, cool. So what else is on the radar here? All right, I got a question here already on Facebook. Kameen writes in, I was wondering if you could tell me when monitoring temperature for adrenal fatigue, what temperature fluctuations could we expect, like 1 to 2 degrees Celsius on the other side, or normal? Thank you. So typically you want, from one day to the other, you want your temperature readings to be within 0.3 degrees Fahrenheit. 0.3 degrees Fahrenheit. When we start having greater fluctuations, that tends to mean there could be an adrenal issue. Now, if we're chronically low, so for an axillary that's below like the armpit, that's below 97.8, or for mouth, 98.2 or below, that tends to be on the lower side, right? Now, if it's chronically low, that's thyroid. If it's chronically low but does jump around greater than 0.3 degrees Fahrenheit, that could be a thyroid and an adrenal issue. And if the temperature is adequate, where it's at a good level, but it's bouncing around, that could be more of an adrenal issue. So that kind of gives you a couple of scenarios of what to look for in that scenario. So adrenal issues, a good temperature but bouncing around. Thyroid issues, low temperature and flat. Thyroid and adrenal, low temperature, but bouncing around and still low within bouncing around. Hope that helps. All right, I got some more questions here coming up. Let me go answer these here for y'all. Good, glad the audio quality is great. Can having bad teeth affect sinuses? Well, if you have bacterial and fungal debris in the mouth, it's possible it can make its way up the sinus cavity for sure, especially if there's a postnasal drip thing happening with there's mucus up in the mouth or in the sinuses dripping down and creating cough. So for sure, it's definitely possible that oral microbiome can affect the sinus cavity. Things are so close, right? So it totally makes sense. One of the big things that I'll do to help with that is we'll do like a nasaline, which is like a suction device that allows you to inject fluid up the nose, and it breaks things up. And we'll do like a neti exfoliator solution with xylitol and some sodium bicarb and minerals that will flush things out, and it has really good antibacterial and antifungal qualities, which are great. Why does the 5-hour program have 2 remove where other functional medicine docs only have 1 remove? Well, I just say because my program's better. So in general, the first remove is removing the bad foods, right? That's the first one. The problem is most people lump in the foods and removing the infections at the same time, and that's the big mistake because it takes a little bit of constitution and stability in your body to go after infection. There's actually a stressor. So the first R is removing bad foods. That reduces inflammation, reduces toxicity, and that improves nutrient density. That's number 1. Number 2 remove is replacing enzymes and acids so we can digest food better. Third remove is going to be, the third R is going to be repair, repairing the hormones, repairing the gut lining. So it's remove the bad food, replace the enzymes and acids, repair the gut lining and the hormones. The fourth R is the second remove. That's where we work on removing the infections. Fifth R, repopulating, reinoculating beneficial bacteria. 6R is retest. And I don't retest everyone. It depends upon how significant the infections or overgrowth is. And depending on that, we make an assessment. Okay, excellent. Having saliva pH at 8, is that good or bad? That's very alkaline. So it just depends. I mean, is that affected by something you're consuming? Is it fasting in the morning? So it really depends upon what you're consuming and what time of day it is. Dank writes in, cold hands and cold feet, full thyroid panel, free, reverse, antibody, all checked out. Good. What else to check? Only thing was cholesterol, slightly out of range, generally poor circulation. So there's a big assumption there. The assumption is that all those markers are correct. So unless I saw the actual numbers in the data, I would say is a possibility they may not be correct. If you're looking at it from a pathological perspective, it may not be good. So I'd have to know the exact numbers to kind of check that off, so to speak. Edmund writes in, can Candida die-off increase histamine? Yeah, it's possible because histamine can happen when your immune system, especially like the basophils / mast cells, produce a lot of histamine, and that can happen with inflammation or any kind of immune or detoxification stress. So if it's happening to you, Edmund, kind of slow up in the taper of the herbs and maybe add some binders and some good lymph support with ginger and just kind of gently nudge that up slower. K. Gupta writes in, what do you think of the new Dutch Plus test, which includes salivary cortisol awakening? I've done a lot of the awakening response stuff regarding the biohealth, the 201 panel. The Dutch already does like fasting when you wake up and then 1 hour later. I think this is now adding a marker in between. It's okay. It's helpful. I think it's a little bit too much information and doesn't change what I'm doing that much. So I've kind of moved away from doing it as much. What is the best self-ordering food sensitivity and stool analysis to take? Food sensitivity just depends. I'm not a huge fan on food sensitivity tests just because of the fact that if you have gut issues, anything you frequently eat, you'll be developing allergenicity / antigenicity to it. So I'm not a huge fan of it. But if your gut's already doing good and your diet's good and your digestion's good and you just want to see if there's any potential sensitivities, I like the MRT or the ELISA-ACT test. Check out my interview with Dr. Russell Jaffe on that one. That's helpful. And then, of course, I like the GI map panel is my favorite for the gut, or the 401H. And if you need to acquire any of those labs, go on my online store, justinhealth.com/shop, and you can get at least the GI map there. If you need to get a ELISA-ACT test, email my office at justinhealth.com, and we'll set you up. Christine writes in, can hydrochloric acid supplement help with the absorption of non-protein foods as well, or should I only take meals containing protein? So first thing is, number one, all your meals should have protein. So you should have protein in every single one of your meals, especially to support blood sugar. Just like with thyroid hormone and a lot of your neurotransmitters and hormone stuff, it's all those building blocks typically contain some level of protein and cholesterol. So you definitely want it at every meal. Hydrochloric acid, if you take it without protein, it's a chance there could cause some warmness in your tummy. But that nice low pH in when you take it does make it harder for bacteria to grow. So there is a digestive component with hydrochloric acid, but there's also a shifting of the pH lower, which makes it harder for bad guys to grow in your tummy. So there is that too, but you should have protein at every meal, and I wouldn't take hydrochloric acid by itself. Maybe the only exception is waking up with a little bit of lemon juice in your water and some sea salt's fine. Sebastian writes in, how do you treat high oxalate toxicity? Having lots of bladder pain due to high oxalate diet I had for a while. I can eat any food without having bladder pain. Any supplement you advise? Yeah, you can do magnesium, and potassium is very helpful. You could also do some lemon juice, drink it in the morning. That does help kind of flush out oxalates. And then, of course, you need to be on a low oxalate diet. And then you need to look at potential fungus and or mold exposure, which could be increasing oxalates too. Alamo writes in, what would cause testing shampoo in mouth after washing hair? Not ingesting it, of course. I'm not sure what you mean by testing it. I'm not sure what you mean by that. But in general, I always use good, clean shampoos. I like the Desert Essence brand. Pretty good. Coconut's my favorite one on that. But yeah, I mean, you shouldn't be putting it in your mouth. Not sure what you mean. Trankirk. Could all the stomach symptoms be vagus nerve dysfunction? And how do you treat that? It depends. I would say probably not. So the more your sympathetic nervous system is activated, the vagus nerve, which is vagus means wanderer or wandering. So it's the nerve that starts at the brainstem, the 10th nerve, and it wanders all the way down, and it affects all the major organs in your body, and it helps with resting and relaxation and digestion. The more that parasympathetic is turned down or dampened, the worse your digestion is. The worse your digestion is over time, you'll eventually develop food sensitivities, bacterial overgrowth, fungus, maybe infection. So the longer there's an issue with the vagus nerve, there's a greater chance other issues now can happen. So the more acute the issue is, potentially it's just a vagus nerve issue. And when I hear vagus nerve, I think adrenals, right? So people talk about vagus nerve, that's way too nuanced. What they're saying is you have decreased vagus nerve stimulation. And if you have decreased vagus nerve stimulation, what's being stimulated? The adrenals. So I actually focus on what's actually happening, which is overt sympathetic adrenal cortisol adrenaline stimulation. And you have to work on that. Your thoughts on neutropenia? Neutropenia. That's low muscle mass. What does that stand for exactly? Neutropenia. Oh, abnormally low number of neutrophils. Yeah, so that's neutrophils are the major white blood cell that's going to go after bacteria. So there could be some type of chronic gut infection or bacterial issue that's causing those white blood cells that are specific for bacteria to be lower. I would specifically look at H. pylori. A lot of times you'll see neutrophils low, lymphocytes high. That's more than likely the problem. How can someone who is hypothyroid and has severe estrogen dominant decrease their estrogen levels in the body? How could someone who's hyperthyroid has severe estrogen dominance? So number one, I always fix all the hormones. So you look at the thyroid, you look at the adrenals, you look at the female hormones. When I run female hormones, I'll look at all the estrogens, and I'll also look at 2-methoxyestrogen. So I'll look at how you're methylating and detoxifying estrogens. And then we'll also look at the gut, which is beta-glucuronidase, which is a marker, an enzyme marker for bad bacteria, but that enzyme also can affect estrogen metabolism. So bad gut issues can easily affect adequate metabolism of estrogen. So we'll just make sure that we avoid plastics, artificial hormones from antibiotics. We'll support progesterone. We'll support upstream signaling of progesterone. We'll support the adrenals. And then we may do things like extra fiber, extra vitamin C, and diindol methane to help metabolize the estrogen too. But it's really important you have a complete picture of what's happening lab-wise too. All right, cool. Is there a connection between ectopic heartbeats and stiff neck pain? So ectopic, is that like kind of a tachycardia, fast heart? I'm not sure what that word means. Let's see what the context of that terminology is. Yeah, so arrhythmia, right? Ectopic or arrhythmia. So anytime we see some type of an arrhythmia issue, I always look at potential thyroid, and I always look at nutrients like magnesium and potassium. And it's possible if those nutrients are off or the thyroid's off, then the nerves could be not functioning in that area. And anytime things not functioning, it's possible there's inflammation. Is it directly causation? Impossible to know, but probably correlated. Colin writes in, if free T4 and T3 drop when going on a carnivore keto, is there a way to bump those up without the introduction of carbs? It depends what you mean by drop. Are you talking about it's normal and it drops a little bit, but it's still relatively normal? Or are we talking it's normal and then drops low? So the context is very much needed. Also, there's no perspective on symptoms. Is there increase in hair loss? Is there increase in cold hands or cold feet or energy? Those type of questions need to be answered before I can give any information on that. You're welcome, Sebastian. Cloud writes in, what are healthy testosterone levels for men 30 to 35? What is the best way to test for it? So you're looking at free and total testosterone. So I would say at least mid to upper 25% of the range. So probably total testosterone, probably upper 500s to low 600s at the low end would be ideal. And then free, I want to say like 60 or 80-ish. You want to look for at least that middle part of the reference range to the upper 25% would be ideal for free testosterone. Does celery juice count towards your daily vegetable servings? Yes, it would. How many? I would look at it potentially if it's 8 to 12 ounces, like 2 to 3 servings. I have food sensitivity to foods which my food intolerance blood test showed all to be negative. How? I have sensitivity to foods which my food intolerance test. Yeah, I mean, it just depends on the lab. What lab did you do? What were they actually looking at? That's why I'm not a big fan of food sensitivity testing, because they can miss things. Mo writes in, I have colitis and adrenal dysfunction. When I'm subjected to even a room temperature air without excessive clothing, my cortisol level starts to drop and I literally start to faint. What could be going on? Impossible to know without having all the data. So there's some level of adrenal issues. The difference is I don't know what type of adrenal dysfunction. Is it low cortisol, high cortisol, in between? How are your adrenaline levels, right? Noradrenaline, adrenaline. How are your thyroid levels? Are there any infections? What's your diet? There's too many. So the problem is most people, they'll give me information. The problem is I'm going to need like 10 things for every one thing you give me. So there's just missing a lot of information so I could respond effectively. Sorry. Dank writes in, free T3 3.3, that looks good. Free T4 1.06, that looks good. TPLS 28, yep, that looks pretty good. I don't have TSH there, but that looks pretty good. Dr. J, what could cause vitamin B6, B5, and vitamin C to be low on an organic acid test? Either a combination of stress, either a combination of malabsorption, not absorbing it well, and or bacterial overgrowth and just poor diet too. Who can I try to write good English for me, guys, so I don't sound like an idiot here? How can I lower blood sugar? Diet strategies, lower carb, keto, paleo, and then of course B vitamins, chromium, magnesium, gymnema, those kind of really good blood sugar, insulin sensitizing compounds. Why can't I breathe better after a hot shower? Why can't I breathe better? Because heat vasodilates and opens up blood vessels. I eat 4 eggs a day. Will my testosterone levels be skewed by that on a Dutch test? I don't see a problem. I mean, you should be eating healthy, nutrient-dense foods, and just because you're doing that, you should be doing that every day. So that should be kind of a normal occurrence, whether it's eggs or high-quality protein or fats. I don't see a problem. Marsha writes in, I have a tingling sensation in my leg and a cold feeling like dripping water. Is this B12 deficiency? Hard to say. Too many other things it could be. We'd have to do some testing to know for sure. Gabe writes in, Dr. J, congrats on the baby. How's your sleep going so far? Any complications with your wife giving birth? Hope all is well. No, we're actually really helpful. We have a nanny during the day that helps out, and my son's been like clockwork. 2.5 hours of sleep, 20 or 30 minutes up, and my wife just can continue to kind of get little micro sleep sessions. So she's doing great, far better than my first child. My first child came about a couple weeks earlier, and her milk supply wasn't great. His sucking power wasn't great. So he came 2 weeks later, which is awesome. So his sucking power was awesome, and her milk supply was great because we almost breastfed our other son for 2 years. So I think just the pipes being opened was huge, and just my son's already up in 2 weeks, almost 1 pound, which is pretty amazing. So he's getting great nutrition. And my wife's nutrition is obviously spot on too. Thanks for asking. So I'm doing good. I'm fortunate. My responsibility is to manage my 2-year-old, and thank God he sleeps throughout the night. Yeah, so Mo, if it's low cortisol, you need to look at the other things going on there with the organics and with thyroid as well, and then also the gut, and to know what kind of gut infections there are too. ET writes in, best functional medicine site in your opinion? Of course, mine, justinhealth.com. I have good podcasts, good interviews, good articles. That's my favorite. One of the only persons online that does these kind of Q&As. Most people, frankly, they can't think on their feet. A lot of people, they're just hiring people to generate their content, and they're not an expert in their own content. So the difference is I actually see, over 1,000 patients. I would say 50 or 60 patients a week, and I would say at least 500 new patients a year. So I actually do this stuff. So because I do it 60 hours a week, I just kind of have to be an expert on it, right? It's either, be an expert or not thrive. So I would give myself a good check. Evan's great. And there's some other really good podcasts out there. Chris Kresser does a good job. Dr. David Jockers does a good job. Dr. Jack Wolfson does a good job. So there's a lot of good people out there too. What do you recommend to improve circulation, reduce inflammation? You can always do systemic enzymes like serrapeptidase. You can do ginger. You can do ginkgo. You can do gotu kola. These are all helpful things. Turmeric, things to reduce inflammation are great. Do you use a Viome gut bacterial test? And if so, would you recommend it? No, I do not. The information is not that helpful. See, Mo writes in, sorry, I have a difficult question regarding fainting, lack of clothes. Thanks anyway. Yep, no problem. Get those tests done, Mo. If you want, email my office. We'll get you set up, and then we could talk about it later. What do you normally eat for breakfast? So today, it's basically about 14 ounces of coffee, 15 grams of collagen, and 1 tablespoon of butter. And then I'll typically have my Topo Chico, which is mineral water. And then I'll typically have 12 ounces of celery juice. And then for lunch today, I will have some kind of a salad, maybe 3 or 4 servings of vegetables, probably 4 to 6 ounces of protein, typically a full avocado and then a nice olive oil or avocado oil dressing. And then my dessert will typically be a handful of blueberries or raspberries with some unsweetened coconut yogurt and some cinnamon. And then maybe I'll have a green apple. And then tonight, it's a pizza night, so I will have a cauliflower pizza, grain-free, and I will do like a diet cheese. Sometimes I'll do cheese as a cheat. I'll do maybe one meal a week with cheese. If I do any more than that, I get mucousy and skin stuff, but typically one meal a week, or I'll do the diet cheese, which is an almond-based cheese. Great questions. I've been off prednisolone and DHEA for a few weeks now, and I'm wondering if being without it is causing a loss of sleep quality and affecting menstrual cycle. Potentially, I would need to know what's going on. Did I recommend and pull you off? If I did recommend pulling you off and you're having some issues, you may want to do a little bit more of a slower taper, Lisa, and maybe taper off over 1 to 2 months. Okay, and if we need to follow up on that more, schedule a consult, or we'll deal with it at our next consult, and we'll go deeper in that, Lisa. Good question. Dank writes in, TSH 1.3, that's great. So if thyroid checks out, what else could I do for cold extremities? Yeah, thyroid looks pretty reasonable. You need to look deeper at the adrenals, organic acids, and then also the gut. Dennis writes in, is there a risk of bleeding with omega-3 supplements? Potentially, if you're going to go in for surgery, you'd want to be off omega-3s and systemic enzymes for at least a couple of days to a week beforehand because they do thin out your blood. But in general, no. Most people's problem is their blood's too thick and it doesn't flow well. How long is it normal for an elbow sprain to heal? I feel like some achiness and the pain times after a month. It just depends. Are you doing things like myofascial release or ART to help reduce the inflammation, to help improve tissue pliability? If it's like that, you could probably have it improve within 4 to 6 weeks. If you're not doing things like that, it could linger on for months because you want to have the right technique done. Same thing with wrist pain. You really need to get a good either active release chiropractor or a really good myofascial release massage therapist or a Graston or Saston kind of person that can work on the tissue pliability. Nita writes in, Dr. J, what do you recommend to keep from getting shingles again? Anything other than the shingle vaccine? Thank you for advance. So first thing you could do is hang out with a little kid that's got chickenpox. Chickenpox provides passive immunity for shingles. Chickenpox is varicella zoster, shingles is herpes zoster. So passive immunity through chickenpox. And the number 2 is get your immune system and your adrenals up. Make sure your diet's solid. You can add in things like lysine, astragalus. You could do things like reishi or medicinal mushrooms, colloidal silver, higher dose vitamin C, silver. All these things will help boost your immune system and provide really good antiviral capacity. What supplements do you recommend for biofilms? Also, your thoughts on Restore Mineral Supplement. So for biofilms, I like my ginger tea. Ginger has lots of data in the peer-reviewed literature on reducing and helping biofilms. Knocking out biofilms allows herbs to work better when you're killing critters. That's why it's part of my kind of die-off protocol. And then number 2 would be my GI Clear 3, which is a silver product, and the silver is shown to have good biofilm reduction. They're actually using silver cellophane in a lot of orthopedic surgeries. They'll wrap up the elbow or the shoulder or the elbow or the wrist or the knee or the hip in this kind of silver cellophane after the surgery because they're finding it helps reduce against MRSA or antibiotic resistant bacteria. Is it always good to remove amalgams, fillings? I've had them for over 40 years. Depends. Look at a heavy metal challenge test, see where your metals are at. If they are high, then you definitely want to see a biologically trained dentist and do it the correct way. Maybe do it in stages, depending on how many you have, and make sure your gut and detoxification systems are working good first. Dr. J, do you recommend anything specific regarding preparation, like biofilm disruptors, which is favorite during or doing a GI map? So I would typically do biofilm disruptors during clearing. So you can taper in the ginger tea and do it during the clearing phase to allow the herbs to be more beneficial and work better. Doing it during the GI map is more moot, not necessary. Any dose recommendation for DHEA, liposomal, and pregnenolone for men and TRT? It depends. I would say without testing, I would just say keep it closer to 5 to 10 milligrams on the DHEA and 20 to 25 with pregnenolone, unless you did testing to know for sure. Anita, you're welcome. What others than surgery can you recommend for horrendous tingling due to carpal tunnel. I was in the UK and I was fine during the day, but worse at home in the Caribbean. So with carpal tunnel, make sure the thyroid's ruled out. A lot of times thyroid issues can be a problem. If it's stuff from like typing, you need to have a good myofascial release, active release person to work on that. You can do things like laser to help as well. And you can do like bioelectric healing devices like at nu.fit, NEU.FIT or ARPWave. These are bioelectric devices that can help reduce inflammation, improve blood flow, and healing. Lisa write in, true fiber gives me nausea as I increase it. Is that normal? Why would this happen? Hard to say. Could be feeding bad gut bacteria. Could be just a die-off thing. Just start with 1/8 of a teaspoon and taper it up and find your max dose, Lisa. Ashley writes in, husband works a stressful job, travels every week from Sunday to Wednesday. He doesn't get to exercise often and can't make his own meals when he travels. Top 3 recommendations to healthy. So I would just have him invest in like a TRX where he can just kind of hang it in his hotel room. And that way he can always do some pull movements, some push movements. He can do some hip extensions off of it. He can do some one-legged squats and then get some bands like the X3 bar. That's really good, or really good bands. So he can do at least curls or pushes or presses this way or deadlifts. So just bands and a TRX, but good bands, like really strong bands, and then a good TRX device that can hang over doorways. That's going to be the easiest, best thing. And then, of course, if he's going to be at the same place the whole time, then try to stay at like a Courtyard Marriott where you can get a little bit of a kitchen, and then you can just Instacart in all the vegetables and meats and all that stuff, so you can at least have a good breakfast and a good lunch. Or find a service like at Paleo on the Go where you can have some meals delivered to that address for the week and then have it all lined up in the fridge. Hope it helps. Does Motilipro serve as a biofilm disruptor? It would, because there's some ginger in there for sure, but use the ginger tea to help more with the biofilms. Couldn't send a super chat. Not available in my region. Well, thanks for trying. I appreciate it. Ali Mo, you're welcome. Low Heat writes in. Chenko Nabu is sumo wrestler dish that contains soup, boiled veggies, boiled eggs, boiled meat, and soy sauce. My question is, what happened to vitamin C in soup? And is 1 teaspoon of soy sauce fine? It depends. Most soy sauce is loaded with gluten, so if you're going to do it, try to do tamare. Vitamin C, not sure about that question. Roxy writes in, thank you. How could I purchase your protocol? I'm not sure what protocol you're referring to. If it's, not sure. You have to give me a little more intel on that. Does ginger cause die-off, or does it help with it? It could cause die-off. Ginger has antimicrobial effects, but it also supports the lymph, so a lot of that debris can move out of the tissue and out of the blood and get detoxified better. So yes, it could cause some die-off, but it also would help with lymph. And if you are having die-off, just sip it slower and go a little bit slower. How much organic non-GMO tofu can be eaten or boiled per day? I would do none. GMO tofu in general it's a phytoestrogen. So I would only do fermented versions of soy, like miso, natto, tempeh. I would stay away from the more processed tofu, which have a lot of estrogen in it. If you're a female, you could probably get away with it, but a lot of women I see have lots of estrogen dominance. So I'd be very careful with that. All right, I think we hit all the major questions here, guys. I think we're doing really good with everything. All right, cool. I'll try to do another video here today, and I'll be back again on Monday. Hope you guys are having a phenomenal weekend. Ashley writes in, diflucan or natural treatment for candida. I always start with natural stuff first before you go to a medicine. There can be some side effects with that stuff. All right, guys, you have a phenomenal day. I'll be back later on. Take care, Facebook. And take care, YouTube. Appreciate it.